Welcome to Hoof Notes, where we make goat science make sense. Today, we are taking a deep dive into something every goat owner has likely encountered or worried about or perhaps, unknowingly, already battled on their farm, coccidia. It's not just a common issue. It's, a microscopic adversary that can silently or sometimes very dramatically impact the health and productivity of our beloved goat herds.
That's absolutely right. And our mission in this deep dive today is really to unpack the intricate science behind coccidiosis. We want to extract the most important insights from recent research. Our aim is to simplify some pretty complex biological information, give you a crystal clear understanding of what's actually happening inside your goats, and most importantly, offer some actionable knowledge, things you can immediately apply to better care for your animals. We're drawing from some excellent peer-reviewed scientific articles and studies to, guide us through this often misunderstood topic.
Okay, great. So, over the next while, we will explore what coccidia actually is. How this tiny, unseen enemy spreads its influence within a herd. We'll cover the telltale signs to look for both the obvious ones and the more subtle ones, and critically, the treatment and prevention strategies available to us. We'll also pay special attention to the crucial foundational role of gut health, because, as we'll discover, that's often where the real battle is fought, isn't it? Let's get started and shine a light on this pervasive challenge.
Basics.
All right, so to kick things off, let's establish a foundational understanding. What exactly is coccidia, and why does it seem to be such an ever-present concern in nearly every goat population? It feels almost inevitable for new goat owners.
Yeah, that's a very common experience, and there's a good biological reason for it.
Right.
At its core, coccidia, which are the causative agent of the disease coccidiosis, they're microscopic protozoan parasites. Now, what does protozoan parasite actually mean for you, the goat owner? It means they're tiny, single-celled organisms. They are not worms. And this is a really critical distinction, because if you're thinking of deworming your goats for diarrhea, your traditional dewormers won't touch coccidia. They simply target completely different types of internal invaders. The disease they cause is specifically called coccidiosis, and in goats, the disease is primarily caused by coccidia of the genus Eimeria.
Eimeria. Okay, so that's the big name we need to remember. Is that a large group then? And is it only affecting goats or?
It's a huge group, actually. There are over 1,800 Eimeria species identified to date across all sorts of animal hosts. But here's where it gets really important for goat owners. Eimeria species are known for their high host specificity. Basically, this means their entire life cycles are typically completed within a single host species. Generally, Eimeria is not known to spread between different host animals. So, for instance, the species that infect your chickens are not known to infect your goats, and vice versa. Even sheep and goats, despite being so similar and often kept together, they are affected by different Eimeria species.
Oh, wow.
Okay, so you don't typically need to worry about your chickens giving Eimeria coccidia to your goats, or your sheep sharing their specific Eimeria species. It's also worth clarifying that Cryptosporidium, you might hear about that one too, it causes scours. Well, it was formerly thought to be closely related to coccidia, but it's now considered a completely separate genus. It has its own distinct characteristics and challenges. So for this deep dive, we're focusing exclusively on those Eimeria species in goats.
That's a really crucial distinction. It definitely changes how you might think about prevention if you're not worried about cross-species infection with typical coccidia, at least from Eimeria. So, understanding that within this Eimeria genus, are there specific types that goat owners really need to be aware of? Like, do we need to memorize a long list of scientific names?
That's a common and excellent question. While 17 different Eimeria species have been identified in goats globally, thankfully, no, you don't need to memorize all 17. Only a handful are typically responsible for the disease outbreaks, the ones that cause real problems and financial losses on a farm. The most frequently reported and, more importantly, the most pathogenic species, meaning those most likely to cause severe disease, are E. arlowengi, E. nenacodiacamuve. That one's often considered the most virulent and damaging of them all.
Then, U. christianseni and E. caprina.
Okay, those four are the main troublemakers. Exactly. There are other species that are valid, and you might find them, but they're generally less problematic. Those include E. elihevi, E. hertzi, E. caprivina, E. S. veronica, and E. jolkigevi. What's interesting, and actually quite common, is for a single goat kid to be infected with several of these species at the same time. You might have a mixed infection where multiple types are present.
Ah, okay.
Yeah, and that can sometimes complicate the picture a bit, maybe make symptoms more severe.
Yeah.
This is why when vets analyze fecal samples, they often look for the presence of these specific problematic species, not just a general positive for Eimeria.
Right, so it's about identifying the specific bad actors rather than just knowing coccidia is present. That makes a lot of sense. Now, you mentioned that high host specificity for Eimeria. Is there any exception to this rule that goat owners should absolutely note, something that might jump species or cause similar issues?
Yes, there is one very noteworthy exception, and it's something many goat owners might have heard of in a different context, maybe even related to human health: Toxoplasma gondii. Now, Toxoplasma gondii is technically a coccidian parasite, and it causes coccidiosis in cats, which are its definitive host. But here's the key part for us. It can cause very serious problems in other animals, specifically abortion in sheep, goats, and even people. In this scenario, sheep and goats serve as what we call an intermediate host for toxoplasma.
Intermediate host. What does that mean exactly?
It means they pick up the parasite, usually from oocysts shed in cat feces contaminating feed or water. The parasite doesn't complete its full life cycle in the goat like Eimeria does, but it can migrate through the goat's body and form cysts in tissues, and crucially, it can cross the placenta and infect developing fetuses, leading to abortion, stillbirth, or weak newborns. In fact, Toxoplasma gondii is actually a common cause of abortions in pregnant animals in the U.S.
Wow. So a totally different mechanism than the Eimeria gut damage, but still a coccidian parasite causing major reproductive problems.
Exactly. So while it's not an Eimeria species and therefore not directly related to the typical gut-focused coccidiosis we're discussing today, it's an important coccidian-related concern. Goat owners absolutely should be aware of it, especially if they have barn cats or neighboring cats that might be contaminating feed or water sources. It's a reminder that not all microscopic threats are the same, even if they share some family resemblance. The spread of coccidia in your herd.
Okay, let's unpack this. The spread. How precisely is this tiny Eimeria parasite getting into our goats? And what are the environmental conditions or maybe management conditions that make it spread so efficiently? Sometimes it feels like it spreads without us even realizing it.
Yeah, and understanding the life cycle here is absolutely crucial for prevention. Coccidia are passed out of an infected goat through the feces. They're passed in a dormant, very resistant form called an oocyst, spelled O-O-C-Y-S-T. And you'll hear us say, oh, I cyst. Now, here's a really critical point. When these oocysts are first passed in the manure, they're not immediately infectious.
Oh, okay. So fresh manure isn't instantly dangerous.
Not instantly infectious with coccidia, no. Think of it like a seed. A seed needs certain conditions: warmth, moisture, oxygen, time to sprout before it can grow into a plant, right? In the same way, these oocysts have to undergo a process in the environment called sporulation. This is where they develop internally and become infective. This sporulation process is absolutely vital because it means that even if a goat passes fresh oocysts, they won't cause infection until they've had time, usually a few days, depending on the conditions like temperature and humidity in the environment to develop, to sporulate.
Got it. So they need time to activate outside the goat.
Exactly. Once they've sporulated and become infectious, goats ingest these infective oocysts simply by coming into contact with anything contaminated with that sporulated fecal matter. This means contaminated udders and teats of the mothers, feed, forage, hay, drinking water, bedding, feeders, basically anything that can get manure on it. It's primarily a fecal-oral transmission. Just imagine this common scenario. A goat steps in contaminated manure, then walks over to eat hay from a low feeder, or drinks water from a trough that has some fecal matter washed into it. Or a young kid nurses from a mother whose udder is soiled. The oocysts are picked up and swallowed. And these sporulated oocysts thrive in warm, moist environments. This makes times like weaning often a period of stress, maybe dietary changes, and higher humidity in barns an ideal season for kids to become heavily infected very quickly.
So it sounds like young animals are especially vulnerable then. And why does it seem so pervasive, almost guaranteed in young herds? It feels like every kid gets exposed.
Yes, absolutely. It's almost guaranteed that nearly all goat kids will become infected with coccidia oocysts at some point. Now, adult animals, they can be infected and often are, but they're generally resistant to the clinical disease. They typically shed small numbers of oocysts throughout their adult life without showing major symptoms. They kind of act as carriers, maintaining the parasite in the environment. It's the young animals, specifically those between about 1 to 4 months of age, that are the most susceptible to showing clinical signs and suffering the severe effects. In fact, Clinical disease often appears most dramatically in 1 to 2 month old kids, especially when they ingest a large number of these infective oocysts very quickly.
And is there something specific that happens around kidding time that makes it worse?
Yes, there is. A really significant factor that contributes to this widespread infection in young stock is something we call the periparturient rise in oocyst excretion in pregnant mothers. This phenomena occurs right around the time of kidding. Basically, the mother's immune system is temporarily suppressed due to the huge physiological demands of late pregnancy and starting lactation. This temporary dip in immunity allows the coccidia already present in her system to multiply more rapidly, leading to a massive increase in the number of oocysts she sheds into the environment.
Oh, wow. So the mothers themselves contaminate the environment just when the babies arrive.
Exactly. The kidding pen or pasture becomes heavily contaminated just when the most vulnerable animals, the newborns, are being born and starting to explore their surroundings, maybe nibbling on bedding or nursing. This situation is likely compounded by residual infection already present in the environment from previous groups of animals. You get this buildup over time. It creates a kind of vicious cycle that exacerbates the multiplication of the parasite through successive groups of kids, increasing their exposure exponentially. It really is a perfect storm for young developing immune systems.
That paints a very clear picture of the biological cycle. But what about our farm management? The environment we actually create for them. How are those factors influencing the spread, and what common mistakes might we be making?
Environmental stressors and management play a major role. In fact, clinical disease outbreaks are often directly linked to poor environmental conditions, sometimes even more so than just the presence of the parasite itself. For example, if you're raising goats indoors, inadequately or irregularly cleaned pens are a huge risk factor. Same with overcrowded conditions. If you have too many kids in a small space, the fecal matter builds up rapidly. And if it's damp, those moist conditions become ideal for oocyst sporulation and survival. Keeping varying age groups penned together also significantly increases risk,
Why is mixing age groups so risky?
because the older, seemingly healthy animals can be shedding oocysts asymptomatically, constantly exposing the more susceptible younger ones who haven't built up immunity yet. This is particularly common in, say, milking herds, where kidding often occurs year-round. You have this constant influx of susceptible young animals into environments potentially contaminated by older carriers.
Okay, so hygiene and stocking density are key indoors. What about goats kept out on pasture? Are they safe?
Not necessarily. Coccidiosis isn't just an indoor problem. Even for goats kept at pasture, it can still appear and cause significant issues. Think about it. If the grass is grazed really short, which is common during dry weather or on overstocked land, kids are exposed to large numbers of oocysts as they graze closer to the ground, closer to where the fecal pellets are. The closer they graze to the soil surface, the more likely they are to ingest oocysts that have been shed and sporulated there. Also, any poorly drained feeding areas, resting spots, or watering areas can become heavily contaminated hotspots for infection. Muddy areas around water troughs are classic examples. And remember, permanent pastures, especially those that stay wet or are heavily shaded, can also harbor overwintered oocysts. That means the threat can persist even across seasons, just waiting for the next susceptible group of kids to come along. So even good pasture management requires vigilance against contamination.
And what about immunity? We hear about animals building immunity to parasites over time. Is constant exposure effective at building protection against coccidia in our goats?
That's a great question, and thankfully, yes, immunity does develop. But it's not instant. It requires about a month, maybe a bit more, of continual exposure to the oocysts for that immunity to truly start developing. Once that initial month or so of exposure has occurred, and the goat's immune system has had time to recognize and respond to the parasite, then further exposure to the oocysts actually enhances and strengthens this immunity. What this means in practice is that once they've built up that protective response, it results in fewer oocysts being shed by the animal. This helps to break the cycle of infection within the herd, reducing the overall environmental contamination. This is precisely why adult animals, despite likely being exposed their whole lives, rarely show clinical signs. Their robust immunity keeps the parasite multiplication largely in check. It's a natural protection mechanism, but it takes time to establish. That highlights why young animals are so vulnerable. They simply haven't had the time or the right level of exposure to develop this protective shield yet, recognizing the signs. Clinical versus subclinical coccidiosis.
Okay, here's where it gets really interesting and frankly a bit insidious for goat owners. The idea that many might not even realize their goats are affected. What is the fundamental difference between clinical coccidiosis, where they're obviously sick, and this subclinical form? And what are those elusive telltale signs we should be watching for?
That's a truly critical point, because the visible signs, the really obvious sickness, is often just the tip of the iceberg. It's absolutely true that most cases of coccidiosis are actually subclinical. This means the goats do not show obvious outward signs of the disease. They might appear outwardly normal, maybe just a little less energetic than their pen mates, perhaps their coat isn't quite as shiny. However, even without those visible symptoms, they are suffering from significant internal impacts. Things like reduced feed consumption, poor feed conversion efficiency, meaning they eat but don't gain as well, and inhibited growth performance. From an economic standpoint, subclinical coccidiosis is arguably the most costly form,
More costly than the ones that get really sick. How so?
because it silently erodes productivity across potentially a large part of the herd without the clear warning signs of clinical illness. Imagine a group of kids where they all look pretty much okay, but secretly, maybe they're taking an extra 2 or 3 weeks to reach market weight. Or maybe your replacement animals are growing slower, taking longer to reach breeding size. Or perhaps milk production in your milking herd is subtly lower by, say, half a pound a day per animal. Over a year, across a whole herd, those small, invisible losses add up to a substantial hit on your bottom line. It costs far more in lost potential and inefficiency than the immediate dramatic costs of treating a few obviously sick clinical cases. It's a silent drain on your farm's profitability.
Wow, that really drives home the importance of understanding this hub clinical aspect. It's not just about preventing deaths, it's about optimizing health and growth. So, switching gears then, what are the signs when it is more obvious? When we have full-blown clinical coccidiosis, what should trigger an immediate alarm for a goat owner?
Right. Clinical coccidiosis can certainly be deadly and usually requires prompt veterinary treatment. Most clinical cases occur in those young kids, typically between 5 to 8 weeks of age. Often it coincides with stressors like weaning, diet changes, or maybe moving pens. The very first signs are often quite subtle, things you might miss if you're not looking closely. Kids may not be thriving as well as expected, maybe failing to keep up with their peers in terms of size or energy. You might notice that while they look okay from a distance, they just aren't gaining weight or growing at the rate you'd expect for their age and breed. They might appear to have a rough, dull hair coat, lacking that healthy shine we all love to see. You might also observe some dirtiness around the tail area. This is often a result of mild diarrhea, frequently just pasty feces initially, not necessarily full-blown liquid scours yet. That pasty butt is a crucial early warning sign.
Okay, so poor growth, rough coat, pasty butt. Those are early warnings. What happens next?
Well, the typical indicator, what most people associate with coccidiosis, is the diarrhea itself, or what we often call scours. It can really range in severity. It might start as just poor fecal pellet formation or that pasty feces that sticks to the tail and hindquarters, but it can progress to more severe acute cases with liquid feces that might be yellowish, greenish, or brownish. In very severe instances, you might actually see reddish liquid feces, possibly with streaks of frank blood or mucus. That's a clear sign of significant damage to the intestinal lining.
Blood in the stool. That's definitely an emergency sign.
Absolutely. That's when you know things are serious and immediate action is needed. Other accompanying symptoms that you should watch for include a decreased appetite, or maybe they stop eating altogether. A general unthriftiness, meaning they just don't look healthy and vigorous, they look poorly. You might see visible dehydration, look for sunken eyes, or if you pinch the skin on their neck, it stays tented instead of snapping right back. Significant weight loss can happen quickly. And signs of abdominal pain, they might stand with a hunched posture, grind their teeth, cry out, or be reluctant to move.
And in the worst cases,
In the most severe problems, it can lead to a very rapid onset of profound diarrhea, often visibly bloody. You might see something called tenesmus, which is severe, painful straining to pass feces, as if they're trying desperately to defecate, but little is coming out. It's very distressing to watch. The kid will become dull, listless, completely lose its appetite, anorexia, become extremely lethargic and weak, and eventually become recumbent, meaning they're lying down and unable to rise. This can ultimately lead to rapid death, sometimes within 24-48 hours if not treated quickly and aggressively. And even in chronic infections, if the animal survives the initial acute phase, there is often permanent damage to the gut lining.
permanent damage. Wow.
Yes, and this leads to that increased time to puberty we mentioned, increased time to finish, meaning it takes significantly longer for the goat to reach market weight,
Hmm.
persistently decreased weight gain, and decreased feed intake. These animals become those poor doers. There have even been some reports, although less common, of liver failure in milking animals due to a specific type called hepatobiliary coccidiosis, which affects the liver and bile ducts.
That's a really comprehensive list of symptoms, highlighting how varied the presentation can be from almost nothing to sudden death. So what's the reason this is sometimes confused with other common goat ailments? What are other conditions that have similar symptoms and could lead someone down the wrong path?
That's an excellent point, because a misdiagnosis can lead to using the wrong treatment, which is ineffective at best, and delays proper care at worst, leading to continued losses. Coccidiosis symptoms, especially the diarrhea, can unfortunately mimic several other common conditions in young goats. These include infections with certain types of gastrointestinal worms, like stomach worms, which can also cause poor growth and sometimes diarrhea. Also, overeating disease, enterotoxemia, which can cause sudden death or severe digestive upset. Bacterial infections like salmonellosis or E. coli scours are big ones, both causing severe diarrhea. Cryptosporidium, which we mentioned earlier, also causes diarrhea, particularly in very young kids, but requires different treatment than Eimeria. And even various viral infections can cause scours. It's also critically important to remember that parasitized kids often suffer from mixed parasitic infections. They might have coccidia and a heavy worm burden simultaneously.
So they could have multiple problems at once.
Exactly. Making diagnosis solely based on symptoms like diarrhea incredibly tricky and unreliable. A goat showing scours could have one of many issues, or even a combination. That's why precise, veterinary-guided diagnosis, often involving fecal tests, is absolutely key to figuring out the actual cause and getting the effective treatment started. You really can't just assume it's coccidia based on scours alone. Unpacking the impact on your goat's gut and beyond.
Okay, let's dive deeper then into the internal impact of this microscopic invader on our goats. You mentioned the intestinal lining damage. What exactly is happening inside their bodies, maybe at a cellular level, that causes such widespread issues like poor growth and diarrhea?
Yeah, this is truly fascinating, and it's where we understand the real depth of the damage coccidia cause. The primary damage occurs right there in the intestinal wall, especially in the small intestine, but sometimes the large intestine too, depending on the Eimeria species involved. Remember, coccidia are intracellular parasites. That means they invade and replicate inside the actual cells of the intestinal lining, specifically the epithelial cells that form the gut surface. As they grow and multiply through their complex life cycle, involving both asexual and sexual reproduction, which happens incredibly rapidly, leading to huge numbers of parasites, they literally destroy these host epithelial cells when they burst out to infect new cells. Imagine your gut lining is this beautiful, intricate surface designed for absorption, like a shag carpet maybe, maximizing surface area. These parasites come in and just flatten it, destroying the cells.
So they're destroying the very cells needed to absorb food.
Precisely. This causes significant damage to the intestinal mucosal barrier. Think of this barrier as a critical defense system. It's like a highly selective border guard for the body. It's designed to allow essential nutrients to pass from the digested food into the bloodstream, but it's also designed to prevent harmful substances, toxins, and unwanted pathogens from entering the systemic circulation, essentially, from getting into the bloodstream and affecting the rest of the body. When this barrier is compromised by the coccidia-destroying cells, that protective shield is breached. It becomes leaky. This opens the door not only to nutrient loss, but also to other problems, like secondary infections and widespread systemic impacts.
And when that barrier is damaged like that, how precisely is their ability to get nutrients from their feed affected? Because that seems like it would directly impact growth and overall health, wouldn't it?
Absolutely. The damage to the intestinal mucosa leads directly to profoundly impaired digestion and nutrient absorption. Those destroyed epithelial cells are the ones responsible for absorbing the final products of digestion amino acids from protein, fatty acids from fat, sugars from carbohydrates. Furthermore, the gut microbiota, those trillions of beneficial bacteria living in the gut that we talk about so much, are heavily involved in key metabolic processes, including breaking down certain feed components and even producing some vitamins. Coccidia disrupts this microbiota too. Studies have clearly shown that protein digestion and absorption are significantly impaired after certain Eimeria infections. This directly impacts the goat's ability to get essential amino acids, which are the building blocks for muscle, enzymes, immune cells, everything.
So less protein getting absorbed means slower growth.
Definitely slower growth, poor muscle development. We also see that total plasma lipid levels, the fats circulating in the blood, can significantly decrease. This directly affects their energy reserves and their ability to maintain body condition, especially during stressful periods. Coccidial infection also dramatically alters carbohydrate metabolism and uptake. The parasites interfere with the enzymes and the cellular transporters needed to absorb sugars, which are the body's primary quick energy source. This can inhibit the carbohydrate supply to tissues, preventing body weight gain, which is why affected kids often look stunted, lethargic, and fail to thrive. Most studies consistently indicate that coccidiosis leads to a significant decrease in blood glucose levels. This further contributes to the profound lack of energy and poor growth seen in affected animals. It's really a multifaceted assault on their nutritional health, literally starving them from the inside of the building blocks and fuel they need to grow and fight off disease.
And what about those gut bugs, the microbiota? We talk a lot about the importance of a healthy gut microbiome on this deep dive. How does coccidia disrupt that delicate ecosystem?
The interaction between coccidia and the gut microbiota is indeed a complex and really crucial network. Coccidial infection significantly decreases bacterial diversity in the small intestine. It essentially throws the gut's delicate balance completely out of whack. Imagine a diverse, thriving rainforest ecosystem in the gut that's suddenly clear-cut and replaced by just a few hardy weeds. This disruption enriches hostile bacteria, meaning it drastically increases the numbers of those bacteria we generally don't want a lot of.
Like which ones?
Genera like Bacillus, Enterococcus, Escherichia, which includes pathogenic E. coli strains, Shigella, Staphylococcus, Klebsiella, and Proteus. Many of these are opportunistic pathogens. They might be present in low numbers normally, but in the disrupted environment caused by coccidia, they can overgrow and contribute to further digestive upset, inflammation, and potentially serious secondary bacterial infections, compounding the damage already done by the parasites themselves.
So the bad guys increase. What happens to the good bacteria?
Conversely, the abundance of beneficial probiotic-like bacteria, the good guys, is significantly reduced. These include vital groups like Eubacterium, Lactobacillus, which many people know from yogurt and probiotics, Ruminococcus, Cristans inalacea, Bifidobacteria, Elastipes, Blaudia, Desulfovibrio, Lactospiraceae, and Roseburia. These beneficial bacteria play crucial roles in everything from digesting fiber, producing beneficial short-chain fatty acids that feed the gut lining, producing vitamins, training the immune system, and outcompeting pathogens. This imbalance, this dysbiosis, is especially severe in young animals. We see similar detrimental effects in goats, leading to a less resilient, less functional, and far less healthy gut environment overall, making the animal even more vulnerable to further problems.
So coccidia doesn't just attack the goat cells directly, it fundamentally alters the entire gut's normal balance, which can then snowball and lead to even more severe secondary problems. It really is like a domino effect then.
It's a truly vicious cycle. The changes in the gut microbiota caused by the coccidial infection create an environment that is incredibly conducive for the reproduction and proliferation of other pathogenic bacteria. Think of it like a poorly managed garden. If you remove all the beneficial plants and disturb the soil, the weeds take over and they flourish. Coccidial infections have been shown to enhance the colonization of nasty bacteria like Campylobacter jejuni, a common cause of food poisoning in humans, also affects animals. Clostridium perfringens, which can lead to that serious, often fatal condition called necrotic enteritis or overeating disease, and Salmonella. And it's not just that these harmful bacteria colonize more easily in the compromised gut. Their pathogenicity, their actual ability to cause disease, also seems to significantly increase in the presence of coccidial damage.
Wow. So the coccidia almost rolls out the red carpet for other bad bacteria.
In a way, yes. The marked inflammatory response in the intestine the coccidia cause also seems to favor the colonization of aerobic bacteria, especially Enterobacteriaceae, which includes E. coli and Salmonella. These bacteria are often antagonistic to beneficial Lactobacillus species, further shifting the balance. A reduction in the strictly anaerobic bacteria, which are crucial for a healthy ruminant gut, can decrease the production of those beneficial volatile fatty acids, important energy sources for gut cells themselves. This can also induce detrimental changes in intestinal pH and the oxidation reduction potential within the gut. These shifts create an even more favorable environment for pathogenic infection, essentially making the damaged gut a playground for harmful bacteria to thrive.
And you mentioned oxidative stress. What is that?
Right. Furthermore, coccidial infection causes increased oxidative stress in the intestine. Oxidative stress happens when there's an imbalance between the production of damaging molecules, called reactive oxygen species, ROS, think of them as cellular exhaust fumes, or rust, and the body's ability to counteract them with antioxidants. Excess ROS are highly unstable molecules that target and damage crucial cellular components like DNA, lipids, fats and cell membranes, and proteins. This causes both functional and structural changes in the cells. This then induces a self-perpetuating cycle of oxidative stress, which further decreases the host's food intake, severely impairs energy metabolism, and contributes to the overall tissue damage and inflammation. It's truly a systemic assault stemming from that initial damage in the gut.
What to look for?
All right, this is all painting a pretty serious picture of what coccidia can do. So if you're seeing some of these varied signs, from that subtle poor doing, maybe a rough coat, all the way to full-blown bloody scours, and you suspect coccidiosis might be the culprit, what are the definitive steps to confirm it in your herd? What does a goat owner need to know about the diagnostic process?
Diagnosis is really based on putting several pieces of the puzzle together. It's very rarely just one single thing in isolation. You'll want to consider the goat's history first. For instance, are you seeing an outbreak of diarrhea primarily in kids older than about 3 to 4 weeks of age? Coccidiosis usually doesn't cause issues in very newborn kids because the parasite's life cycle takes time. The age of the kids involved is a big clue. The specific presence of those clinical signs we discussed, especially persistent or severe diarrhea, is important. And also, are the prevailing environmental conditions suboptimal? Is it wet, crowded? Is sanitation maybe lacking? These factors together help create a strong suspicion, but confirmation really requires more investigation.
So suspicion is based on history and signs. What's the next step for confirmation?
A critical step is fecal examination. Your veterinarian will likely ask you to collect fresh fecal samples. And it's best to sample several goats, not just one sick one. Include samples from animals showing clinical signs, but also from some that appear healthy but perhaps aren't thriving as well as their pen mates. This gives your veterinarian or the diagnostic lab a much better overall picture of the herd status and the parasite burden across the group.
Okay, so you collect the samples. What happens then? What are they looking for?
They perform what's called a fecal flotation. This technique uses a special solution, usually a saturated salt or sugar solution, which has a higher specific gravity than the parasite oocysts. When the fecal sample is mixed with this solution and allowed to sit, the heavier fecal debris sinks, while the lighter oocysts float to the top. They can then be collected on a microscope slide and examined under the microscope. In cases of clinical coccidiosis, the feces usually show high oocyst counts, often reported as OPG, or oocysts per gram of feces. However, and this is a really key point that confuses many people, interpreting these counts can be quite complicated.
Complicated how? Doesn't a high count mean disease?
Not necessarily. The mere presence of high oocyst counts is not always definitive for clinical disease. Remember we talked about pathogenic versus non-pathogenic Eimeria species. Goats can sometimes excrete large numbers of oocysts from non-pathogenic Eimeria species without showing any symptoms at all. You might have a goat shedding millions of oocysts per gram but look perfectly healthy if those oocysts are from a species that doesn't cause significant gut damage. Conversely, sometimes in very acute severe cases, especially early on, a kid might be incredibly sick with severe gut damage, but hasn't started shedding large numbers of oocysts yet, or shedding may have already peaked. So a low count doesn't automatically rule it out either, especially if the clinical signs are strong.
Okay, so the number alone isn't the whole story. You need to know which coccidia are there.
Exactly. Therefore, speciation is highly recommended, especially in outbreak situations, or if treatment doesn't seem to be working. Speciation means identifying the specific Eimeria species present to ensure that they are indeed those known pathogenic ones we discussed earlier, like E. arloingi, E. ninocholiacomova, E. christenseni, E. caprina. For a lab to do this accurately, it usually involves allowing the oocyst collected from the fecal sample to sporulate first. Remember that development process they need to go through outside the goat?
Right, the activation step.
Exactly. Typically, this is done by intubating the fecal samples or the oocysts concentrated from them in a shallow layer of a solution like 2% or 2.5% potassium dichromate at room temperature for about 7 to 10 days. This controlled environment provides the oxygen and conditions needed for the oocysts to mature internally into their effective, identifiable sporulated form.
Okay, so speciation is crucial to know if the oocysts are actually the bad guys.
Yeah.
How do labs identify them once they have sporulated, and what does that tell us?
Once sporulated, the different Eimeria species oocysts can often be distinguished based on their morphology. That is, their physical characteristics viewed under a high-powered microscope. Labs look at things like their precise size. Length and width measurements are critical. Their overall shape, are they perfectly oval, slightly pear-shaped, almost round? Their color, and the presence or absence of specific structures like a micropyle, which is a small pore at one end, and whether that micropyle has a distinct cap over it. Precise measurements using a calibrated microscope eyepiece, taking both longitudinal and horizontal diameters, are absolutely crucial, as is knowing the typical sporulation time for different species. For example, we mentioned E. erlewingi are typically quite large, maybe 24 or 30 micrometers long by 15-20 micrometers wide. They have a prominent micropyle cap, and they sporulate relatively quickly, often within 1 to 6 days. E. ninicolucimophovasis, on the other hand, tend to be smaller, maybe more oval, and might sporulate even faster. In recent diagnostic studies, pathogenic species like E. alliavi, E. arlowingi, E. christianseni, and E. ninicoliakimove have been successfully identified using this detailed morphometric approach. And as we noted, it's very common for mixed species infections to be observed. The lab report might list several different pathogenic species found in the same sample.
So it's quite technical work, measuring tiny differences.
It is. While you, as an owner, won't be doing these microscopic measurements in your barn, understanding why your vet might recommend sending samples to a specialized diagnostic lab for speciation helps you appreciate the precision needed. It's about correctly identifying the specific pathogenic Eimeria species causing the problem, which can then guide the most effective treatment plan and give a better idea of the potential severity. It's not just about finding any oocyst, but finding the right oocyst causing the disease.
Are there other ways to diagnose besides looking at feces?
Beyond fecal examination, which is definitely the primary and most common diagnostic method for live animals, there are a couple of other approaches, though less common. In some very severe cases, particularly during a post-mortem examination if an animal dies, veterinarians might take impression smears. This involves pressing a microscope slide directly onto the surface of the intestinal lining. Under the microscope, they might be able to see various stages of coccidial development right there within the gut tissue itself. And again, in the most severe and unfortunate cases where a goat has died from suspected coccidiosis, a full postmortem analysis, including histologic examination of intestinal tissues, is the gold standard for confirmation. A pathologist can actually look at thin slices of the gut tissue under the microscope and see the characteristic damage to the cells and identify the different life stages of the parasites within those cells. This provides definitive proof of infection and the extent of the damage.
Okay, so we've got the traditional microscopic methods for diagnosis. Are there any more modern or advanced ways coming online? Perhaps something that offers even more accuracy or maybe speed?
Yes, absolutely. While morphological identification based on size and shape under the microscope is still the primary method used in most veterinary diagnostic labs and is very valuable, molecular methods like polymerase chain reaction or PCR are increasingly being used, especially in research settings and some specialized labs. These methods are different because they don't rely on visually identifying the oocyst. Instead, they target specific, unique sequences of DNA within the parasite's genome. Common targets are genes like the 18S ribosomal RNA gene, the cytochrome C oxidase subunit 1 COX1 gene, or internal transcribed spacer regions like ITRS1 or ITS2. These molecular tests are generally known for their higher sensitivity, meaning they can potentially detect infection even when oocyst numbers are very low, and potentially higher accuracy, especially for distinguishing between species that look very similar morphologically. They are particularly valuable for corroborating morphological identifications, especially when oocyst counts are low or when speciation based on appearance alone is challenging or ambiguous. They can also help resolve ongoing controversies regarding Eimeria species classification, giving researchers an even clearer and more precise picture of exactly which parasitic threats are present in a herd or region. This is especially useful for epidemiological studies and for tracking the emergence or spread of specific strains.
So PCR is more sensitive, but maybe not yet standard for everyday farm diagnostics.
That's generally fair to say right now. While PCR offers advantages, it's typically more expensive and requires specialized laboratory equipment and expertise, so it's less commonly used for routine farm-level diagnostics compared to fecal flotation and microscopic examination. But it's a powerful tool that's becoming more accessible over time and plays a key role in research and confirming difficult cases, treatment, and prevention strategies.
Oh. Okay, so let's say the diagnosis is confirmed. It is coccidiosis, caused by one or more of those pathogenic Eimeria species, and it's causing problems in your herd, whether clinical or subclinical. What are our options for treatment? And maybe even more importantly, how can we keep it from happening in the first place? This is really where the rubber meets the road for goat owners needing practical solutions.
Absolutely. This is the key question everyone wants answered. And before we dive into the specifics of different products or approaches, it's absolutely vital to state this upfront, and it bears repeating. Always consult your veterinarian when it comes to your herd health. This is especially true regarding treatments, some of which may be illegal, or require specific veterinary oversight for use in food animals like goats in the United States. Your vet is your primary resource for an accurate diagnosis, for recommending safe and effective treatment plans tailored to your specific situation, your local regulations, and your herd's specific needs. Please, never administer medication without veterinary guidance.
Understood. That's a crucial disclaimer. Always partner with your vet. So, assuming you're working with your vet, what are the conventional approaches they might discuss or prescribe for treating or preventing coccidiosis?
The most common form of treatment and prevention involves a class of medications called coccidiostats. As the name suggests, these are drugs specifically designed to target coccidia. They generally work by disrupting the parasite's life cycle at various stages, either killing them directly, coccidiocidal, or, more commonly, preventing them from multiplying, coccidiostatic, which allows the goat's own immune system to clear the infection. They are available in various forms, most commonly liquids for drenching or adding to water, and also as feed additives. And it's vital to remember what we said earlier. Conventional anthelmintics, your standard dewormers for roundworms or tapeworms, have no effect whatsoever on coccidiosis. They target completely different types of parasites. So if you suspect coccidia, reaching for your usual dewormer bottle won't help and will only delay proper treatment.
Okay, so we need coccidiostats, not regular dewormers. What are some common coccidiostats vets might use for goats?
One widely used coccidiostat is amprolium. It's often sold under the brand name Corid. Amprolium comes as a liquid concentrate that can be mixed into drinking water as a preventative measure for a whole group of animals, or it can be given orally as an individual drench for treatment. It works in a clever way. It's structurally similar to thiamine, vitamin B1, which the coccidia desperately need to reproduce. Amprolium essentially gets taken up by the parasite instead of thiamine, blocking the parasite's thiamine metabolism and starving it of this crucial nutrient. However, and this is important, using amprolium in goats is technically considered extra-label use in the U.S.
Extra label, what does that mean?
It means the drug is not specifically approved and labeled by the FDA for use in that particular species, goats in this case, for that specific condition or dosage. Using drugs extra label is legal under certain conditions, but requires strict veterinary guidance and a valid veterinarian client-patient relationship, VCPR. Your vet takes responsibility for its use. Also, a rare but serious potential side effect of amprolium, particularly if used at high doses or for prolonged periods, is polioencephalomalacia, often called goat polio. This is actually a thiamine deficiency in the goat itself, ironically caused by the drug interfering with thiamine. It causes neurological signs. This is another critical reason why careful dosing according to veterinary instructions and strict adherence to treatment duration are absolutely paramount when using amprolium.
Okay, so amprolium is one option, but needs careful vet supervision. What else?
Many sulfonamide medications, often called sulfa drugs, can also be used effectively to treat coccidiosis. These are broad-spectrum antimicrobials that inhibit the growth of coccidia by interfering with their folic acid synthesis pathway. They are often sold in liquid or powder form that gets mixed with water. A common example is sulfamethoxine, sometimes sold as Albin. Sulfa drugs can be quite bitter, which can make goats reluctant to drink the medicated water.
Right, getting them to take bitter medicine can be tough.
It can. So some commercial sulfa products include flavoring agents to improve palatability. Alternatively, your vet might suggest adding something palatable, like unsweetened Kool-Aid, Jell-O powder, or a bit of molasses to the water solution to encourage adequate consumption, ensuring they get the full therapeutic dose. Again, your vet will advise on the correct type of sulfa drug, the dosage, and the duration of treatment.
Okay, so amprolium and sulfa drugs are common treatments, often given in water or as a drench. What about preventative options in feed?
Yes. Then there are the feed additive coccidiostats. These are medications incorporated directly into pelleted feeds or mineral mixes at specific concentrations. There are three main ones sometimes used in small ruminants. Decokinate, often sold as Decox, is labeled for prevention of coccidiosis in young goats and sheep. Lacilocid, often sold as Bovatici, is labeled for sheep in confinement, but sometimes used extra label in goats under veterinary direction. And monensin, sold as Rumensin, is labeled for prevention in confined goats. These are generally best used as a preventative measure, especially when creep feeding young kids. Creep feed is a starter feed offered only to the kids, not the mothers. Including a coccidiostat in the creep feed provides them with continuous protection during that high-risk weaning and post-weaning period. They can also sometimes be strategically fed to pregnant animals in late gestation prior to kidding. This helps limit that periparturient rise of oocyst shedding we talked about, reducing the contamination of the kidding environment for the newborns. But it is absolutely imperative to feed these medicated feeds at the correct rate to ensure the animals consume the right dosage of the coccidiostat daily. Underdosing won't provide adequate prevention, and overdosing, especially with ionophores like lacilocid and monensin, can be toxic, particularly if fed to the wrong species, like horses, or at too high a level. So, precise feed mixing and delivery are crucial, and they are definitely not medications to guess at. Precision and following label or veterinary directions are key.
That's incredibly helpful to understand the different conventional options and the nuances, the liquids for treatment, the feed additives mainly for prevention, and the importance of veterinary guidance for all of them, especially extra label use and dosing. Now, what about natural approaches or different management strategies that can help? Perhaps for owners looking for alternatives or ways to supplement conventional methods, maybe reduce reliance on drugs.
That's a great question because natural alternatives are definitely gaining significant interest. This is driven partly by consumer demand for residue-free products, growing concerns about drug resistance developing in parasites, and just a general interest in more holistic or sustainable farming practices. Research into plant-based solutions is showing some quite promising results.
Like what kind of plants?
Well, one fascinating study published relatively recently looked specifically at using neem leaf powder for treating naturally occurring coccidiosis in young goats. Neem is a tree known for various medicinal properties in traditional systems. In this study, they administered neem leaf powder in a capsule daily. The results were quite significant. The mean OSIS count in the group treated with neem leaf powder dropped by an impressive 84% over the treatment period. This was compared to a 61% decrease in the group treated with a conventional commercial sulfur-based anticoccidial drug.
Wow, 84% reduction with neem. That's substantial.
It really is. And the big takeaway here is that neem leaf powder is a natural product, presumed to have no drug residues, which makes it a potentially very safe option for use in food-producing animals. That's a major advantage for producers concerned about withdrawal times or residues. Interestingly, this particular study also found that the neem treatment significantly reduced strong agal-type worm egg counts as well, suggesting it might have a broader benefit for overall internal parasite control, potentially acting against both coccidia and some worms. Of course, more research is always needed to confirm these findings and determine optimal dosing and long-term effects, but it offers a compelling look at a potential plant-based solution.
That's really interesting about neem. Are there other promising natural options being studied?
Yes, another one that has received quite a bit of research attention, particularly in the southeastern U.S., is dried pelleted Sericea lespedeza, often abbreviated as SL. This is a type of forage legume, but unlike alfalfa or clover, it's known for being very high in certain compounds called condensed tannins. These condensed tannins have demonstrated significant antiparasitic properties against both gastrointestinal worms and, excitingly, against Eimeria coccidia. Studies have shown that simply feeding SL pellets, often replacing a portion of the regular diet, to recently weaned goats, can significantly reduce Eimeria oocyst counts in some studies by an astounding 91% to nearly 97% within just 7 days of starting to feed it.
Within a week. That's incredibly fast.
It is remarkably fast and effective. And the research also shows it significantly reduces gastrointestinal nematode, GIN, counts the worm eggs, and consistently improves fecal consistency scores, meaning less diarrhea and fewer clinical signs of coccidiosis. The goats just look better and have firmer manure. SL pellets are typically incorporated as a portion of the daily feed, maybe 25–50% of the diet, and since they seem to be palatable, goats generally consume them readily. This approach is exciting because it offers a non-chemical, residue-free way to manage coccidia and worms simultaneously, just by modifying the diet with a specific forage. It aligns perfectly with a more holistic, sustainable approach to herd health management, essentially using nature's own medicine cabinet found in plants.
Using feed as medicine, essentially.
Yeah.
That's fascinating. Okay, so beyond specific treatments, whether they're conventional drugs or natural options like neem or Sericea lespedeza, what are the absolute best management practices we can implement on our farms to keep coccidiosis at bay, to prevent it from ever becoming a clinical problem in the first place?
This is arguably the most important part because environmental stressors and management practices play such a major role in whether coccidia actually cause disease. Implementing strong, proactive management is absolutely crucial for prevention, perhaps even more so than relying solely on medication after the fact. Prevention is always better and usually cheaper than treatment. First and foremost, always avoid overcrowding animals. This seems simple, but it's critical. More animals crammed into a smaller space inevitably means more concentrated fecal matter and consequently much higher OS cyst exposure for every single individual in that group. Give them space. Consider using pasture rotation more effectively or creating larger pens or temporary paddocks to reduce stocking density, especially for those vulnerable young, recently weaned groups.
Okay, so space is number one. What's next?
Second, maintaining impeccable sanitary conditions is non-negotiable. This means regular, frequent, thorough removal of manure and any wasted feed from pens, shelters, and high-traffic areas. The goal is simple. Break that fecal-oral transmission cycle. Less manure means fewer oocysts in the environment. Remember, coccidia oocysts thrive and sporulate best in warm, wet environments. So it is paramount to keep areas where your animals commonly congregate, like around feeders and water troughs, in shelters, under shade trees, as dry as possible. This might involve improving drainage around buildings or waterers, maybe putting down gravel pads, using elevated slatted flooring in high-traffic indoor areas, or frequently adding fresh, dry bedding to absorb moisture. Any standing water or perpetually damp, muddy spots are potential oocyst breeding grounds that need managing.
Dryness is key. What about how we feed and water them?
Absolutely critical. Design your feeders and water systems specifically to minimize fecal contamination. Ideally, feeders and waterers should be raised significantly off the ground so animals aren't easily stepping or defecating directly into their food and water sources. Using hanging feeders, trough feeders with rails they can't stand in, or waterers with narrow openings or nipple drinkers can significantly reduce the chances of cyst ingestion through contaminated feed and water. Think about how easily a kid can climb into a low pan feeder and contaminate it.
Good point. What about around kidding time? Any specific management there?
Yes, that's a high-risk period. When it comes to kidding season, you need to clean and sanitize kidding jugs or pens thoroughly before the kidding season begins. Get rid of the buildup from last year, and then, ideally, clean and sanitize meticulously between each individual mother that uses them during the season. This prevents the buildup and spread of infective oocysts from one animal to the next, protecting those highly vulnerable newborns who are just starting to explore their environment and potentially picking things up. A clean birthing environment is truly your first line of defense.
Makes sense. Any other management tips?
One more strategy is to utilize creep feeding effectively. We mentioned this in the context of medicated feeds, but it's beneficial even without medication. Creep feeding involves gradually introducing a grain or pelleted starter feed into kids' diets before they're fully weaned, typically in a separate area or feeder that only the smaller kids can access. This does two important things. First, it helps create a less stressful transition when they move from relying solely on milk to digesting solid feedstuffs. Reducing weaning stress is important because stress weakens the immune system, making them more susceptible to coccidiosis. Second, as we mentioned, it provides an excellent opportunity to introduce an in-feed coccidiostat for prevention during this critical period of high stress and susceptibility if you and your vet decide that's appropriate for your herd management plan. It's a proactive, multifaceted approach combining nutrition and potential medication delivery.
That's a really robust set of strategies for prevention space, sanitation, dryness, feeder design, kidding hygiene, and creep feeding. Sounds like management is truly key. Are there any other avenues of research or future possibilities for control that could, change the game for goat owners down the line? Maybe something easier than all this management.
Well, everyone hopes for a silver bullet. Research is definitely ongoing, particularly in the realm of vaccines, which would indeed be a potential game changer for coccidiosis control, just as it has been in the poultry industry. While vaccines against chicken coccidiosis have been highly successful and are widely adopted commercially, their development for ruminants, including goats and sheep, is still quite limited and presents some significant scientific and practical challenges. However, some experimental studies have shown very promising results. For instance, researchers have demonstrated that immunization using live but attenuated oocysts, meaning the oocysts, have been weakened or modified, often by treating them with exirradiation so they can stimulate immunity but not cause severe disease, can indeed protect goat kids from clinical coccidiosis when they are later challenged with fully virulent parasites. These studies have shown protection against disease signs and also a significant reduction in oocyst production, sometimes by over 80%, which would also help reduce environmental contamination.
So vaccines are possible, but not ready yet.
Exactly. This is highly promising because it shows the principle works immunity can be stimulated effectively without causing severe disease. But much more research is definitely needed before this becomes a widespread practical reality for goat farmers. Scientists are still actively investigating crucial factors like what is the optimal age for immunization? How young can we vaccinate kids without interfering with the passive immunity they get from colostrum? What is the ideal dose size of the attenuated oocysts needed to trigger strong immunity? What are the best and most reliable attenuation techniques to ensure both safety and efficacy? And critically, how do we account for the complex interactions between the different Eimeria species? Since goats are often infected with multiple species simultaneously, a truly comprehensive vaccine would ideally need to protect against several of the most common pathogenic types, Arlomingi, Nicoyakamiavi, Christianseni, etc. Developing a multivalent vaccine that covers all the key players adds significant layers of complexity to development and testing. So, while a safe, effective, multi-species vaccine for goat coccidiosis would truly be a revolutionary tool for producers worldwide, realistically, it's still on the research horizon, not something you can likely buy next year. The bigger picture, prognosis and future considerations.
Okay, so bringing this all together now, thinking about the long term, what is the outlook, the prognosis for a goat that gets coccidiosis, especially if it's a severe case? And what are researchers continually learning that might help us manage this better in the future?
That's an important question because the impact of coccidiosis isn't always just about whether the animal survives the initial bout of diarrhea. In severe cases, the intestinal damage caused by those pathogenic Eimeria species can actually be permanent, or at least very long-lasting. This results in what many experienced farmers sadly refer to as poor doers, animals that fail to recover fully from that initial intestinal damage. They might survive, but they never quite achieve their full genetic potential for growth or milk production. They often remain chronically unthrifty, smaller than their peers, and just don't perform well. And because their gut integrity and likely their overall immune system have been compromised by that early severe insult, they often remain much more susceptible to other diseases throughout their lives, things like recurring bouts of pneumonia, heavier worm burdens, or other opportunistic infections. Their resilience is just lower.
So the economic losses aren't just from deaths during an outbreak.
Exactly. The economic losses for goat operations are substantial, and they come not just from direct mortality during acute outbreaks, but significantly from this reduced productivity, slower growth, lower milk yield, poor reproductive performance, and the ongoing treatment costs associated with managing these compromised, poor doer animals throughout their potentially shortened productive lives. It's a significant hidden cost that really adds up over time and impacts overall farm profitability.
That really underscores the importance of prevention and early intervention.
It does. And to further illustrate the scale of this challenge, a major scientific study was published recently, a systematic review and meta-analysis. This type of study pulls together data from many smaller studies conducted all over the world to get a big picture view. It showed that the overall global prevalence of Eimeria species infection in goats is estimated to be a staggering 62.9%. That means, on average, almost two-thirds of goats worldwide are infected. Now, there's definitely regional variation. The analysis found North America had the highest estimated prevalence at a whopping 92.2%, and Europe was also very high at 86.6%. Asia reported the lowest prevalence, but still significant at 52.0%. Regardless of the regional differences, these findings powerfully underscore the pervasive presence of potentially pathogenic Eimeria species in goat populations globally and highlight the significant economic losses they represent for the goat industry worldwide. It's clearly not just a localized problem for a few farms. It's a truly global challenge that impacts food security and farmer livelihoods everywhere goats are raised.
Wow, 92% prevalence in North America. That's almost universal exposure. So, understanding this global prevalence, the potential for long-term damage, and the economic costs, what is your ultimate take-home thought for our listeners? As they continue to care for their herds and inevitably face this challenge, what's the most important thing to keep in mind?
Given that incredibly high prevalence and the widespread presence of pathogenic Eimeria species globally, the most important message is that an integrated parasite management IPM approach is absolutely essential for effective, sustainable control of coccidiosis in goats. It's really not just about relying on a single magic bullet treatment or only reacting with medication once you see animal scouring. It has to be about a holistic, proactive, year-round strategy. This strategy needs to combine those sound management practices we discussed, focusing on sanitation, dryness, avoiding overcrowding, smart feeder design to minimize environmental contamination and reduce exposure in the first place. It should also involve exploring and appropriately utilizing natural support options where evidence supports them, like Sericea lespedeza, potentially reducing reliance on chemical treatments. And, crucially, it must include engaging targeted veterinary intervention for accurate diagnosis, for appropriate treatment of clinical cases, and for developing strategic preventative medication plans when necessary, always under veterinary guidance. It's about having multiple tools in your toolkit and using them wisely. Continuous learning, like listening to this deep dive, keen observation of your animals daily, and the adaptability to adjust your management plan based on what you're seeing in your herd and your environment. These are truly our strongest tools in safeguarding the health and productivity of our beloved goat herds. Ultimately, prevention, through smart management and strategic interventions, is far more cost-effective and humane than dealing with widespread disease outbreaks and managing chronically poor-doing animals. Final thoughts?
Wow, what a deep dive that was. Today, we really explored the intricate, sometimes hidden world of coccidia. We've tried to understand its pervasive impact on our goats' guts, their overall health, and the quite comprehensive range of strategies available to us as responsible goat owners. We went from understanding the basic life cycle of that tiny oocyst to the absolutely critical importance of gut health and the microbiome, and then delving into both the conventional treatments like coccidiostats and some of those emerging natural options like neem and Sericea lespedeza.
We've certainly covered a lot of ground. Thank you so much for guiding us through this complex but absolutely vital topic. Your insights are incredibly valuable and, I hope, very actionable for every goat owner listening out there.
You're very welcome. It's a critical topic, and hopefully breaking down the science makes it a little less intimidating. Absolutely. To our listeners, we truly hope this deep dive has equipped you with a clearer understanding and some practical steps you can consider to protect your herd from coccidiosis. Remember, as we've emphasized, your veterinarian is always your best partner in goat health. They're essential for accurate diagnosis and for helping you decide on the safest and most effective treatment protocols for your specific animals and farm. Keep learning. Keep observing your animals with a keen eye. Look for those subtle signs, not just the obvious ones, and trust your instincts when something doesn't seem right. We'll be back with another Hoof Notes deep dive soon.